Hello everyone, this presentation is to introduce team strategies and tools to enhance performance and patient safety. Abbreviation is TeamSTEPPS. The following education material derives from HRQ TeamSTEPPS website. If you want to more detailed contents, you can access to this website. TeamSTEPPS objectives. Discuss the TeamSTEPPS framework and the key principles, describe the components of a multi-team system, MTS, describe for communication tools and strategies, describe effective team leader skills and the 3 tools for leading teams, define situation monitoring, describe techniques for facilitating situation monitoring, describe 5 tools and strategies for facilitating mutual support, identify tools for use in conflict resolution, describe available behavior associated with effective team performance, summarize barriers to teamwork tools and the strategy to overcome teamwork barriers and the potential outcomes, and apply TeamSTEPPS tools and strategy to a clinical scenario. TeamSTEPPS framework. TeamSTEPPS stands for team strategies and the tools to enhance performance and patient safety. TeamSTEPPS focus on specific skills supporting team performance principles, including training requirements, behavioral methods, human factors, and cultural change design to improve quality and patient safety. Within this course, teamwork concepts are introduced, including specific tools and strategies for improving communication and teamwork, reducing chance of error and providing safer patient care. More than 30 years of research and evidence have been accumulated on teams and team performance in diverse areas such as aviation, the military, nuclear power, healthcare, business, and industry. TeamSTEPPS has evolved from research in these high-risk fields to the healthcare environment, a high-risk, high-stakes environment in which poor performance may lead to serious consequences or death. Based on research, we know what defines a team, what teamwork requires, how to train team members, and how to manage team performance. Researchers have linked team training programs to improve attitudes, increase knowledge, and improve the behavioral skills. For example, a meta-analysis published in 2008 included a comprehensive search of team training literature from 1955 through 2007 and examined over 300 empirical articles. Although this meta-analysis was not specific to team training in healthcare, its results demonstrated evidence that team training had a moderate positive effect on team outcomes. TeamSTEPPS is built upon an evidence-based framework composed of 4 teachable, learnable skills: communication, leadership, situation monitoring, and mutual support. The core of the TeamSTEPPS models. The red arrows depict a two-way dynamic interplay between the 4 core skills and the team-related outcomes of enhanced knowledge, positive attitudes, and exceptional performance. Encircling the 4 skills is the patient care team, which represents not only the patient and the direct caregivers, but also those who play a supportive role within the healthcare delivery system. Key principles. There are 5 key principles presented in this course. These principles correspond with the TeamSTEPPS fundamentals course modules, which provide more in-depth introduction to direct care staff. In this course, we will highlight key concepts from each module. Team structure identifies the components of a multi-team system that must work together effectively to ensure patient safety. Communication, process by which information is clearly and accurately exchanged among team members. Leadership, the ability to coordinate the activities of team members by ensuring team actions are understood, changes in information are shared, and the team members have the necessary resources. Situation monitoring, a process of actively scanning and sensing situational elements to get information, understanding, or to maintain awareness to support the functioning of the team. Mutual support, the ability to anticipate and support other team members' needs through accurate knowledge about their responsibility and workload. Team structure. Team structure refers to the composition of a team. In healthcare, multiple teams are involved in patient care. This model is known as a multi-team system or MTS. Each team within an MTS is responsible for various parts of patient care, but all must act in concert to ensure quality patient care. A key component of a MTS is the patient. Patients are part of the patient care team and should be embraced and valued as contributing partners to patient care. In addition to the patient, the multi-team system is composed of several different teams. Core teams consist of team leaders and team members who are involved in the direct care of the patient. Core team members include direct care providers and continuity providers. Continuity providers are those who manage the patient from assessment to disposition, such as case managers. The core team is based where the patient receives care. Coordinating team. The coordinating team is the group responsible for day-to-day operational management, coordination functions, and resource management for core teams. Contingency teams. Contingency teams are formed for emergent or specific events, time limited. For example, a core team, the disaster response team, or rapid response team, and composed of team members drawn from a variety of core teams. Ancillary service consists of individuals who provide direct, task-specific, time-limited care to patients. Support services that facilitate care of the patients and are often not located where the patients receive their routine care. Auxiliary services are primarily a service delivery team whose mission is to support a core team in general. An Ancillary services teams functions independently. Support services are primary service-focused team whose mission is to create efficient, safe, comfortable, and clean health care environments, which impact the patient care team, market perception, operational efficiency, and patient safety. Administration includes the executive leadership of a unit or facility and has 24-hour accountability for the overall function and the management of the organization. Administration shapes the climate and culture for a teamwork system to flourish by establishing and communicating vision, developing and enforcing policies, setting expectations for staff, providing necessary resources for successful implementations, holding teams accountable for team performance, and defining the culture of the organization. As far within and across components of a multi-team system, communication is critical to the effectiveness of a team and to ensuring patient safety. TeamSTEPPS provides several communication strategies that can be used to ensure effective communication. The first technique is SBAR. SBAR provides a standardized framework for members of the healthcare team to communicate about a patient's condition. You may also refer to this as the SBAR, where I stands for introductions. SBAR is an easy to remember tool that is useful for framing any conversation, often a critical one requiring a clinician's immediate attention and action. In phrasing a conversation with another member of the team, consider presenting the situation, what is happening with the patient, background, what is a clinical background, assessment, what do I think the problem is, recommendation, what would I recommend? Let's look at a short video clip in which the SBAR technique is used.
Hi, Dr. Feldman? Yes, this is Amy from 2 West. I've been taking care of Miss Everett. Well, she's an 82-year-old woman. She was admitted 3 days ago with DVT. She's on heparin, telemetry, and oxygen. She's been alert and pleasant with no problems other than urinary retention. And she has a Foley in place. But tonight she appeared confused. She's awake and oriented to person, but she thinks that she's at her aunt's house and that Ronald Reagan is president. Yeah, well, no, I checked with her nurse from the last few nights and confirmed that she doesn't sundown and she's normally very sharp. Her heart rate has increased to 110. Her blood pressure is down to 110/60. Yeah, her systolic usually runs 150. Yes. Her temperature is 37 Celsius. She looks pale, but not uncomfortable. Her coag studies are within the parameters, and her blood gas is normal. All other AM labs are normal. She's not putting out much urine, and it looks cloudy to me. I'm worried about her. I think she needs to be seen. Want me to order some labs? Maybe send her urine for culture?
Yes, sounds like she could be getting septic. Send a urinalysis with culture, chemistries, and a CBC. Thanks for calling. I'm on my way, but I need to know if there are any changes immediately.
Call out. Another communication tool is the call out. A call out is a tactic used to communicate critical information during an emergent event. Critical information call out in these situations helps the team anticipate and prepare for vital next steps in patient care. It also benefits a recorder when present during a call or emergent event. One important aspect of a call out is directing the information to a specific individual. Checkback. A checkback is a closed-loop communication strategy used to verify and validate information exchange. The strategy involves the sender initiating a message, a receiver accepting the message, and confirming what is communicated, and the sender verifying that the message was received. As shown in the example on the slide, the doctor communicates an instruction, the nurse repeats it back, and the doctor closes the loop by verifying that the nurse received the message accurately. Hangoff, when a team member is temporarily or permanently relieved of duty, there is a risk that necessary information about a patient might not be communicated. The hangoff strategy is designed to enhance information exchange at critical times, such as transition in care. More importantly, it maintains continuity of care despite changing caregivers. A proper hangoff includes the following: transfer of responsibility and accountability. When hangoff, it is your responsibility to know that the person who must accept responsibility is aware of assuming responsibility. Similarly, you are accountable until both parties are aware of the transfer of responsibility. Clarity of information. When uncertainty exists, it is your responsibility to clear up or ambiguity of responsibility before the transfer is completed. Verbal communication of information. You cannot assume that the person obtaining responsibility will read or understand written or nonverbal communications. Acknowledgement by a receiver. Until it is acknowledged that the hangoff is understood and accepted, you cannot relinquish your responsibility. Opportunity to review. Hangoffs are a good time to review and have a new pair of eyes evaluate the situation for both safety and quality. Additionally, hangoff include the transfer of knowledge and information about the degree of uncertainty and certainty regarding the patient. For example, whether the diagnosis has been confirmed, the patient response to treatment, recent changes in condition and circumstances, and a plan of care, including contingencies. It is important to highlight that both authority and responsibility are transferred in a hangoff. As identified in root cause analysis of sentinel events and poor outcomes, lack of clarity about who is responsible for care and decision making has often been a major contributor to medical error. I pass the baton. Each facility should determine a standard protocol for delivering hangoff and make a protocol known to staff. I pass the baton. Provides one option for conducting structured handoff. Instruction. Introduce yourself and your role job include patient name, identifiers, age, sex, and location. Assessment. Presenting chief complaint, vital signs, symptoms, and diagnosis. Situation. Current status, circumstances, including core status, a level of uncertainty, recent changes, response to treatment, safety concerns, critical lab failures reports, socio-economic factors, alerts, forced isolation, and so on. Background, comorbidity, previous episodes, current medications, family history, actions, what actions were taken or are required, provide a brief resume. Timely, level of urgency and explicit timing and prioritization of actions, ownership, who is responsible, a nurse, doctor, team, include patient family responsibility. Next, what will happen next? Anticipated changes. What is the plan? Their contingency plans. Active team leaders. Another critical aspect of teamwork is effective team leadership. Team leaders are well-informed team members who make decisions and take actions. Team leaders establish the goals of the team and help maintain its focus. There are two types of leaders, designated and situational. For a team to function successfully, a leader must be designated. In most clinical situations, the physician in charge is the designated team leader. Situational leaders emerge at the designated time, such as during anesthesia induction and at spontaneous times. For instance, the first responder to a call. When leading teams, both designated and situational team leaders must possess a set of effective skills regardless of the type of team they are leading or the situation in which they are leading it. At its core, leading teams involves the following activities: identifying a goal and defining a plan to achieve the goal, assigning tasks and responsibilities, sharing the plan, monitoring the plan and the process toward the goal, modifying the plan and communicating changes to all team members, and reviewing the team's performance. It is critical that when leading teams, designated and situational leaders also establish rules of engagement under which team members will operate and perform their roles, manage and allocate resources effectively to ensure team members have what they need to be successful. Provide feedback to team members regarding their assigned responsibilities and process toward the team's goal. Facilitate information sharing among team members. Encourage team members to assist one another when needed. Facilitate conflict resolution and model effective teamwork. Team events. Leading teams involves team events that include the activities of planning, problem solving, and process improvement. Three strategies that team leaders can use to facilitate these activities and promote teamwork are briefs, huddles, and debriefs. As shown on the slide, briefs are conducted at the start of a shift or a case. For example, to share a plan with the team, we will review briefs in more detail shortly. Huddles are ad hoc sections to review and modify the established plans. They may involve reviewing the plans to ensure all team members continue to be on the same page and adjusting the plan based on unknown and anticipated changes. Debriefs are conducted to review what has occurred, such as after case, These sections are intended to improve team performance by identifying and reinforcing what went well and what can be improved. We will review the briefs in more detail shortly. Brief checklist. Briefs are a strategy for sharing a plan when leading a team. During a brief, which is sometimes referred to as a team meeting, the following information should be discussed. Team membership and roles, who is on the team and who is the designated team leader. Clinical status of the team's patients, the current condition, diagnosis, and the status of each patient assigned to the team. The plan of care for each of the team's patients was to be accomplished, while the expected outcomes and who is to do it, and issues affecting team operations. Resources normally available that may be restricted during the current shift. Defining clear goals and a plan to achieve those goals in an important part of the brief, as well as establish clear roles and expectations for each team member. Successful teams measure their effectiveness in terms of how well they are performing against the established plan. The designated team leader usually conducts the brief, and the team members actively participate. Similar to a pre-flight checklist used in aviation, the team leaders should cover items on this or a similar checklist. Conducting a brief at the beginning of the shift or prior to a case provides an ideal forum for communicating with other team members about the goals for each patient and the plan of care to ensure patient safety. Let's look at a short video clip that demonstrates a team conducting a brief.
Okay, she currently only has intermittent late decelerations, and these have improved with her position changes and supplemental oxygen. We'll monitor her until she's fully dilated and allow her to push. If there's any evidence of fetal distress or persistent late decelerations, we should be prepared to go to C-section.
I've alerted the OR to be prepared in case we need to use it.
Great. I'll discuss this plan with Mrs. Keys when we're done here. What are her vitals right now?
Normal, just checked 15 minutes ago.
She's had no late deceleration since you recall.
Let's continue to monitor her. I need to know when she's complete and pushing so we can keep a close eye on her second stage. Any questions?